Welcome, Assalamu alaikum. Today we are once again at the St Vincent mental health facility at the Vincent Pallotti Life Healthcare. And we are fortunate today to be sitting with the Deputy Chair of St Vincent, clinical psychologist Cheryl Daniel without the S. Very welcome. Welcome to Accidental Muslims.
You're
Claire,
welcome.
thank you for hosting us here.
No problem.
We've been to the absolutely fantastic facility.
It's beautiful.
Claire, you've been at Vincent Pallotti. You were working with the nuns here 20 years ago.
That's
So
right,
you've
yes,
been,
yes,
you're
yes,
more
yes,
than
yeah.
part of the
Yeah.
of the furniture. You're part of the foundation of this institution.
I actually am.
Yeah.
Yes.
So-
I've seen it come from a little hospital to a huge, big facility.
Yeah. So the St Vincent, the mental side of things,
Yeah.
it's separate from the main hospital.
Yes.
And we understand the reason for that. But can we touch on the need for a facility like that?
Yes, absolutely. We found in the hospital itself that there were more and more patients coming in through our ER with panic attacks,
Yeah.
with depression. They come with physical symptoms,
Yeah.
and they are seen by the doctor, and the doctor says, listen, we've examined you, there's nothing wrong with you, you've got to have a look at your stress, look at your depression, and
Yes.
then I get called in. And this was happening more and more often. So we discussed the need in the hospital as such, and that's St Vincent's.
And it's 2 years now that it's been established, correct?
It's been, yes, 2 years, but this year is the year it has actually been going at capacity.
Yeah. No, well done,
Yeah.
and congratulations
Yeah.
on a fantastic facility.
Yeah, it's beautiful.
Well, I actually, I wouldn't
Yeah.
mind to spend a night there because it's like a hotel, you know, you just want to check in.
Yeah, no, it's really
But Claire, I want to speak about I would like you to explain to me rather, and our viewers, what is a clinical psychologist? I think for many people, for myself included, it was very confusing knowing what a psychologist does, what a psychiatrist does. But can you tell us what is the role of a clinical psychologist?
Yeah, the role of a psychologist is that we actually we're involved in the recovery of a person that suffers from depression or any of the other mental disorders.
Yeah.
But we are the people that we don't do the medication. The psychiatrist does the medication. We get involved with making the person stronger through giving them coping skills, but also changing their thought processes. Many times we find that people become depressed because they do have mind traps, like, I can't recover, I'll never get out of this. So we use CBT, which is a cognitive therapy. It's cognitive behavioural therapy, so the way you think is the way you're going to behave. We use interpersonal therapies, we use behavioural therapies, we adjust it to our patients, and we give them coping skills, but also give them a more positive way of thinking. To catch those thoughts before they actually go over and just cause a lot of stress and depression.
So those therapies that you're talking about
Yeah.
is no different than, I would think, from a session like this where we're just
Yes,
sitting
exactly.
and talking.
That would be an interpersonal therapy.
Wow.
Where cognitive behavioural therapy would be, look, okay, what are your thoughts before you actually get into a state of complete depression? Now let's look at those thoughts, and then before they actually just flow through, how do we change it into more positive thoughts so that it just doesn't just flow down? Okay. We find
Guys,
that
so therapy sessions is no more than just coming and talking to somebody. I mean, there's nothing to be afraid of. I know it's like going to the dentist. You're always afraid of, you know, the unknown.
Yeah,
So
no.
really, it's just sitting and talking and explaining your situation, and
Absolutely.
you giving tools,
Yeah,
I think,
yeah.
as the professional.
That is the tools,
Yeah.
the coping skills, you know,
Yes.
on how to get a better grip on your depression, you know, to get a better understanding of your depression, and to understand there's nothing wrong being depressed. The people that suffer from cancer, they have diabetic, the people suffer from various illnesses, they go to a doctor, they get help. They get medication, it helps them. Now, depression to a large extent is also a chemical imbalance. So you need to get that help. You go to a psychiatrist who gives you the medication to try and sort out that chemical balance. But the psychologist is also involved, and especially in our clinic, we play a huge role in saying, okay, come, what caused this depression? Is it the way you think? Is there certain things that happen to your life? And we deal with, you know, I'm not going to be biased. I'm going to be honest that the two of the disciplines work together.
Oh, okay.
And one should never work on its own.
Okay.
A psychologist needs the psychiatrist to be able to work on the serotonin levels, okay? There's chemical imbalances to help with the depression,
Yeah.
okay?
And that's interesting because I wasn't aware of that.
Yes.
So you actually complement one another.
We complement each other.
Yeah.
Where the psychologist goes out and helps you to deal with the times when you're feeling down, to give you constructive coping skills so that you don't just fall back into the same old ways which have caused the depression in the first place.
I see.
Okay.
Who does one see first?
Always the psychiatrist, and then they will refer to a psychologist.
But at the same time, seeing you, you would obviously see that I would need to be referred to a...
Absolutely. That happens. If you come to me and you say to me, Cheryl, you know what, this and this, and I don't want to get up in the morning, I'm tired, there's nothing that makes me happy anymore, and I go through the session with you and I see that you're lacking emotional energy, which is your serotonin, then I will refer you to a psychiatrist and we'll work together. And if necessary, we will admit you to St Vincent's, and together we will see you. I will see you a bit more regularly than the psychiatrist because I've got to do more work.
Yes.
But the psychiatrist will see you regularly too to make sure that the medication he's put you on works properly.
Mm.
So we work together.
Mm.
You should never work just going to a psychiatrist because that means you're not getting the coping skills. And if you come to me as a psychologist and I can see that you need to get your serotonin levels up, I mustn't ignore that. I must refer you to a psychiatrist.
Cheryl, being in practice for the last 30 years...
30 years, yeah, long time.
You've got a lot of success stories, I'm
Yes.
sure.
I would actually like to speak about a patient that was pretty close to me. Because I work in the hospital itself, it was an oncology patient, and he came in and he was diagnosed with incurable, obviously, cancer, and he became extremely depressed. And the oncologist referred him to me, and we worked together. And eventually, you know, I got him through the coping skills and a lot of behavioural therapy and CBT. He got himself back into life, and he started to enjoy his life. And he actually changed the way of thinking of, I wish I could just die and get over all of this. He changed it into, you know what, I will live until the day I die. And that's the way he lived. He started enjoying it. He went to the beach with his dogs and he didn't waste his time. And that is because he could move from depression into dealing with the living, and not, because the thing is with depression, it can steal your life away from you.
And in many cases it does.
It does.
I mean, if we consider the amount of suicide cases that we have.
Yeah.
And unfortunately, it only really gets the exposure that it does when it happens to well-known people or celebrities.
And yet it happens all.
Yeah. I always refer to it being able to happen to everybody. If you look at the late Professor Mayosi, what a brilliant man. I hear so many good things. And, in fact, my mom was very close to him, working in his staff. And the science wasn't there. And I mean, a brilliant mind like him in the medical fraternity, you know, it stole his life.
Yeah. And that's sad because, you know, I think of people's expectations, and you feel that if you say, well, you know, I'm depressed or this, you feel you're going to be judged, you know. So many times, you know, yes, it's only when there's a celebrity you think, oh, wow.
Yes.
And yet it's happening all the time.
Yeah.
You know, but it is curable. They must just reach out and you know, we can deal with it. They can deal with it.
And you spoke about your patient or client that had a terminal illness.
Absolutely.
What about those that are just suffering from depression?
Yes.
There's so much to live for.
Absolutely. And that is what he taught me. Sometimes my patients teach me things, and that is what he taught me. It doesn't matter how dire the circumstance, you can change it into something positive for you. You can find a lot of things why you want to live. That again, it comes to the mindset.
Cheryl Daniels, thank you so much.
You are so welcome, and enjoy the rest of your day.